quite complex. So maybe if time permits and people are interested, Samantha and Christina, you could even go into some of those letter templates in more detail.
Yeah, I welcome that, and I encourage you to be informal, and I'll definitely help you with answering in the chat. So I've officially started the recording, so I'm going to do a quick intro here, and we have another minute. We're going to let folks join, and I'm going to be clicking admit here. So if you're just joining us, welcome everyone. My name is Melissa Baldwin, and I'm the Director of Florida Clinicians for Climate Action, and you're here for our December meeting. It's just getting started now, so I'm going to give folks a few more minutes to join. And in the meantime, I'm going to share my screen with our intro page. And I would encourage you, if you're just joining us, to just go ahead and put your name and your area of expertise, and students are welcome, so if you're a student, that's okay, and the city that you're joining us from. And I'm gonna share, and I'm gonna hit play. Okay, so I'm gonna give it another minute or so because I know folks are still gonna be joining us, and I wanna give time for folks to join. But while I do that, just a little bit of background. If you're new to our group, Florida Clinicians for Climate Action, we're a small nonprofit outreach and education group. We're made up of health professionals who are concerned about climate impacts in Florida and wanting to take action for equitable solutions. So at Florida Clinicians for Climate Action, we engage health professionals to learn about the health harms of climate change and then advocate for equitable solutions. And equity is really important to everything that we do. It's really central to our mission. So that's a little bit about us. And in this picture here, you see me, the director, and then in blue there, that's Dr. Mona Sarfati. She's actually the executive director of our parent organization. And that organization is based at George Mason University, and it is the Medical Society Consortium on Climate and Health. They helped to found our organization, and behind her you see Dr. Mark Mitchell. He's another founding member. He's actually based in Connecticut, but helped us get started over 3 years ago. And then also our founding co-chair there on the left is Dr. Cheryl Holder. So that's a little bit about us and Florida Clinicians for Climate Action. And if you are just joining us, I encourage you to put into the chat your name, your area of expertise, and if you're a medical student, that's great. No matter what your specialty is, we want to welcome you. We welcome all health professionals to learn and get engaged on climate. And then the city that you're joining us from. And I am going to hit the next button here. So before I pass it on formally to our presenters who we're very excited to have here for you today, I want to just make a few quick announcements and make sure that you check out a couple of great stories in the news that I want to make sure that you saw. Health Affairs Magazine actually featured some of our medical students who you're going to be meeting on the call today for doing some really great work in bringing climate change to their medical school. Also, if you haven't seen it yet, you've got to check out the Lancet Countdown 2020. It just came out earlier this month, and there's some really powerful information in there. Another thing I just came across literally before this call is a wonderful little short video. It's about a 7-minute video. It's put together by some of our partners, the Clio Institute, and it talks about energy equity and access to energy efficiency and the higher energy burden that some communities face. And it's really remarkable how high the power bills can be for people who live in low-income housing, $200 a month, $300 a month, $500 a month. And so it's really a concern, and this is an issue that we work a lot on. And so I really encourage you to think about energy efficiency and how you can get involved. And you can do that just by joining our group, signing up for us, our newsletter, and staying involved, because we do a lot of work around energy efficiency goals in Florida. And my final announcement before I pass it over to our presenters is that we have our big annual symposium coming up in January. That is going to be the Cobb and FCCA Climate, Health, and Equity Symposium. It's a one-day online CME program. It's going to be in January on a Saturday. So I will put the link to all of those things in the chat in just a moment. And now I'd like to introduce our topic. I'm super excited and grateful to have a wonderful group of presenters here today to share with you some of the work that they've been doing in building a new medical legal partnership on climate and health. And they'll explain to you what is a medical legal partnership, how does it relate to climate and health, and how can it help you as a clinician to help advocate for better conditions for your climate your patients who are at risk of climate health impacts. So I'm really super excited and grateful to have our presenters. And today you will be hearing from 5 different people. Samantha Cools is a staff attorney for Community Legal Services of Mid-Florida. Christina Walters is the manager at Community Legal Services of Mid-Florida. And then Dr. Fred Anderson is a medical director at the Department of Humanities and Health and Society at Florida International University, Herbert Wertheim College of Medicine. And then his 2 medical students who have been really stars and were featured in that health affairs article that I talked about earlier, Samantha Rodriguez and Miranda Ricart. And so without further ado, I'm going to stop sharing and I'm going to pass it to Dr. Anderson, who will introduce. And I will be active in the chat to answer questions. We'd ask you to please hold your questions to the end. We have a lot to go through, and also we will be monitoring the chat and try to answer your questions as well. So thank you so much to our guests for joining us. Thank you to all of you for taking time out. I know 2020 has been a really tough year, especially for health professionals. So you spending your time with us tonight really means a lot, and we're excited to present this new information. So with that, I will pass it to you, Dr. Anderson.
Thank you so much, Melissa, for your kind words. We really appreciate people taking the time out of their busy evenings to spend it with us today. This has been very much a labor of love and a collaborative effort between the clinicians, many of the FCCA membership, actually. So before we go into it, I just wanted to give a word of appreciation to many of the FCCA clinicians who had helped to give feedback to us on improving these letter templates that we'll be going into in further detail. I also want to encourage, if people do have questions during the presentation, please feel free to put them in the chat box. And those of us who are not speaking will seek to address some of those questions in the chat box if we can. So without further ado, I would be delighted to hand it over to our STAR medical students, Samantha and Miranda, who may be able to give us a little bit of background as to what led to this collaboration.
Hi everyone, sorry, we're at the hospital right now, so it's a little bit tricky with the phones and Zoom and everything. But some of what came forward with the medical legal partnership was really a big effort from Dr. Anderson in spearheading this idea of engaging with legal advocacy work and combining the physician's perspective in a way that can best advocate for patients in ways such as like encouraging screens for housing for low-income residents that otherwise don't have the capability of it, making sure that people who are working outside, like migrant farm workers, are obtaining adequate water and rest and shade breaks, and such. Like the list goes on and on for the types of engagement that medical legal partnerships can really engage with. And I think this is the idea of joining forces to kind of give a voice to our patients and to, from the legal perspective, their clients, really encouraging this type of unified approach to best advocate for individuals that we're encountering on a day-to-day basis. Miranda, I don't know if you want to jump in and say anything additional.
Yeah, so Sam and I gave a presentation in June about, basically Sam just summed up our presentation, and we were able to partner with the Medical Legal Partnership, and they've been working ever since to create these letter templates. And so that's the goal of our meeting today, is to go through the templates and make sure that our physicians understand their purpose and how to apply them. So please feel free to ask any questions that you might have. And I also just wanted to again emphasize that this could never have happened with everyone who was involved in writing these letters, reading these letters, providing feedback. So we really appreciate all of the support that you've given us. And hopefully these letters are useful to you and your patients. So I just wanted to introduce our two speakers today briefly. Christina Walters, like Melissa said, is the manager of public interest and medical legal partnerships for Community Legal Services of Mid-Florida, or CLSMF, where she organizes medical legal partnerships education for a regional network of MLPs. She provides technical assistance to MLPs throughout Florida and oversees the sustainable implementation of MLPs in CLSMF's 12 county Central Florida service areas. She's been involved in MLPs since 2013, working as an MLP staff attorney in Palm Beach County prior to joining CLSMF. And Christina graduated from the University of Florida Levin College of Law and received her undergraduate degree from FAU, Florida Atlantic University. Samantha Cools is a staff attorney for Community Legal Service of Mid-Florida in the Medical Legal Partnership Unit. For the past 3 years, she's been the MLP attorney for a medical home in Orlando, Florida, providing legal assistance to patients, conducting trainings for the healthcare providers, and offering consultations for the healthcare staff. Samantha graduated from the Indiana University Robert H. McKinney School of Law and received her undergraduate degree from USF, University of South Florida. So thank you both so much for all of your help on this project and for being here today. Without further ado, go ahead and get into your presentation.
Thank you very much. I know that our titles are quite a mouthful, especially mine. It's like 10 words long or something ridiculous. But as Miranda said, my name is Christina Walters, and I am the Manager of Public Interest and Medical Legal Partnership at Community Legal Services of Mid-Florida. And I'm going to get us started by telling you a little bit about what a medical legal partnership is. And I'll be referring to them frequently as MLP, just because medical legal partnership is a whole lot to say, and we only have a little bit of time. So basically an MLP is an upstream approach to healthcare in which we embed an attorney into the healthcare team to remove the social determinants of health that have a legal issue at the crux of them. So we do a variety of areas of law, everything from housing law, domestic violence, Social Security, helping folks get Medicaid, all sorts of different civil legal issues. The reason that we do medical legal partnerships is because, as you all know, I don't know, the stats different everywhere you look. Somewhere between like 60 to 80% of somebody's health is determined by the social determinants versus medicine, biology, genetics. And so when we take that and we add to that the fact that based on the Legal Services Corporation's Justice Gap report from 2017, they say there that 71% of low-income households have experienced at least one civil legal problem in the last year. So when we take 70% of your health is made up of not medicine, genetics, that kind of stuff, plus the fact that over 70% of the population is seeing at least one civil legal problem, we can see that there are barriers that can be removed by these legal needs. There's 4 main activities that we do in medical legal partnership. We train healthcare providers to identify the legal needs. So your patient might come to you and say that they don't have enough food to last them through the end of the month. And your thought might be, okay, let's get them to a food pantry. But also with that, maybe they need to appeal a food stamps denial. Maybe they need to appeal a Social Security denial, and that's the issue. Maybe they should be receiving unemployment benefits because of COVID and haven't. So all those different things, we train staff to recognize those issues and make referrals to us. We treat patients on a one-on-one basis by representing them, providing advice, all the way through full representation in litigated court cases. We help to transform clinic and institutional practices by doing the thing that we're going to talk to you about today. doing things like creating letter templates that you as clinicians can then use throughout your clinic or hospital system. So it doesn't require that one-on-one, because I can only meet with so many people within a year. But if I provide you all with resources, you can reach so many more. And then the fourth thing that we do is we prevent social determinants even more broadly and upstream by doing things like taking on impact cases where we can, through litigation, make a change to policy or law. And also some MLPs take place with legislative advocacy. Next slide. So this slide here, basically just a quick history of medical legal partnerships. In like the 60s, down in Mississippi, they realized that their patients were having housing and food stamps issues. And so they brought in attorneys to help solve those problems. In the 80s, a lot of hospital systems were using attorneys to do end of life documentation for patients who had AIDS. So things like healthcare surrogates and living wills. And then in 1993, we had medical legal partnerships as we do them today were really developed, and they were developed at Boston Medical Center. There, one of the doctors in the pediatric department realized that his patients with asthma were coming back to the hospital over and over again. And when he started asking questions about their living situations, he found that after they were released from the hospital, they were going home to places that didn't have heat in the winter, or full of rodents or mold or roaches. And so he had somebody he knew over at the local legal aid and brought them on board, and they were able to get the landlords to do what they're legally required to do by keeping the house habitable, or the apartment habitable. And by doing that, those patients stopped returning to the ER as frequently. So that's the model that we use today. We have attorneys. Generally, the way an MLP works is that an attorney is on site at the healthcare institution. The healthcare staff screen for legal needs of the patients and then make referrals to the attorneys. I'm going to pass it over to Samantha and she's going to talk to you about the advocacy templates a little bit more, what they are, how we use them, and then we'll talk a little bit about the 4 that we created.
All right, so what is an advocacy template? It's a template that is added to the electronic health record system of a healthcare partner that can be easily accessed by the clinicians and healthcare staff and personalized on behalf of the patient with any type of health harming legal or social needs. All right, and why should we use these type of templates? They are effective, they can effectively assert and protect the legal rights of individual patients and their families. They expand the capacity of a healthcare provider to reach more patients, and they make life easier for clinicians and other staff. If you can just easily access it in the EHR and just plug in a few key things and it automatically would populate, then it'll just be something that would take less time and easy to do for everyone. And it also, the most important, it will create a paper trail or some evidence for your patients when they have a legal issue and they need to provide notice. They have something to rely on stating that they at least took the first step. So when an attorney does need to get involved, they can help with an appeal or other legal action that needs to take place. How to use the template. So our templates, they are pretty complex, but we have broken it down where there will be a page that has information for the healthcare provider, kind of explaining the purpose of the template that they will provide to the patient. The second page will be an information page for the patient that informs them of what their legal rights are, where to sign on the template, what to expect after providing their landlord or school or workplace the template, so they're kind of prepared of what may happen next. And the third page is the page where the patient will sign stating that they are having an issue, and they do have to state some particular language that is in the template. As long as they sign it and present it to the appropriate party, then they'll be good to go. The fourth page would be the letter of support that the healthcare provider would sign kind of attesting, creating that link of the person's disability and the reason why they need the accommodation that's being requested. And I will pull up the templates for you in a bit so you can kind of see the 4 pages that complete the entire template. All right, so the first reasonable accommodation template that we will discuss today is in regards to housing. Under housing, the law that would be relied upon is the Federal Fair Housing Act, which it is to protect certain classes, which could be based off of race, color, national origin, religion, family status, sexual orientation, gender identity, and the one that we're going to be discussing today would be disability. And the Fair Housing Act is for everyone to state that they should have like an equal opportunity to use and enjoy their dwelling unit and any common public common areas in their units. One of the main factors that we have on the information page for the providers is stating that the definition of disability under the Fair Housing Act, it is different than Social Security's definition of disabled. Because we want whatever provider that reads these templates or want to rely on the templates, know what definition they should be relying upon to use for the patients, because it's extremely, extremely broad under the Fair Housing Act. The definition is right here, which states that disability is defined as a person with a physical or mental impairment / disability that substantially limits one or more major life activities, or a person with a record of such an impairment, or a person who is not disabled but is regarded as disabled. And the major life activities could be anything that would affect your ability to function. So caring for yourself, seeing, hearing, breathing, walking, comprehending, thinking, anything that will impair you from doing an activity that you're trying to execute. Right, so the first template that we have is in regards to terminating a lease agreement. Early termination in this context of being affected by climate change can be due to poor housing conditions such as mold, possibly infestation of pests, and other things as well. If there was maybe like a hurricane or something to that effect where it damaged a portion of the household, depending on being exposed to the elements, that can also be a reason to do early termination of your lease. The person will request, when they make the request, they have to always state that they are disabled under the Fair Housing Act and the reason they need the accommodation, and just draw a link between the two of those such things. Any accommodation that is requested, it has to be reasonable, because the person that receives the request, if it's burdensome to them, then it might not be considered reasonable. We want to give both the requester and the requestee options and what the request is, to make sure the request is reasonable and it's not going to put too much pressure on either party. And then I do have another example here that is quite common. A patient that has asthma and they're living in a mold infested unit, and that will affect possibly their breathing and sleeping and other things. As long as there's a physician willing to attest to what the downside is to that particular person and how it's affecting them, then the accommodation is likely to be requested. If it's not, then it's always good to get an attorney involved to see what other legal recourse that the patient might have. The next accommodation related to housing that we have is for a cooling agent. It could be
Sam, can I pause you for 1 second? I'm sorry.
Yeah, absolutely.
I just want to point out for the clinicians on the call that you don't need to make a determination into disability as if Social Security was going to make that determination. That's not what needs to happen. Basically, there needs to be a health condition that is worsened by the housing condition, so that you have that link, and that would be considered a disability under these types of laws. Because I know that question has come up before. the definition Social Security uses is completely different and much harder to meet. So the bar is, the threshold for disability under these accommodation letters is much lower than it would be for somebody who is trying to get Social Security. For example, asthma doesn't generally work to get you disability benefits, but it would work to get you these accommodations.
Right. Yeah, it's definitely low. And for our example for a request to repair a cooling agent, the same rule applies. You just kind of have to state how the person is affected by the condition and why they need to possibly move. The scenario that I was kind of envisioning for a request for a repair of cooling agent would be someone might have a seizure disorder and they're triggered by heat, or maybe they even have high blood pressure, which is something generally you wouldn't get disability benefits for. But you could get a reasonable accommodation to move to a unit that doesn't have those issues of needing the AC being repaired or ceiling fans or windows, possibly if that's preventing them from having their temperature regulated. And then we do have an example that Samantha as well as Miranda provided with Hurricane Irma, where there has been advocacy for cooling agents in nursing homes after Hurricane Irma hit, when the generators were affected. And because of that, now it is required in Florida that assisted living facilities, they must have generators and also annual inspections of those generators. So that's not going to be an issue going forward, hopefully. Right, and reasonable accommodation in employment. This is under a different set of laws, which would be the Americans with Disabilities Act. And I still find similarly to the way it's defined under the Fair Housing Act, where it's an extremely low bar of what someone with a disability would be considered. It just has to impair or substantially limit a major life activity, which could be pretty much anything. And under the Americans with Disabilities Act, the job that you have to be able to perform it the way it's intended to be performed. So if you have an impairment that's preventing you from doing that, then you can use a reasonable accommodation under this type of law. An example would be a patient who works a job with increased sun exposure and they need breaks under a shaded area. So if they're under this circumstance, they could just provide this type of letter to their employer and it should be requested. There is a lot of misconception when people are providing a reasonable accommodation request to their employer. They do not have to disclose the exact name of their disability or be very specific about the nature of their disability. They literally have to just state that they're disabled under the American with Disabilities Act, or it could be, under the Federal Fair Housing Act, and that should be sufficient. So they don't have to feel like they have to expose every little detail about their medical condition to their employer because it's not required under the law. Right, and the last template that we have is a reasonable accommodation request in education. And Christina is going to tell us a little bit about this one.
So students who are disabled or have health conditions have the right for accommodations. Oh, can you go back, Sam?
Oh, sorry.
It's okay. There you go. They have the right to accommodations, just like somebody, an adult would in employment under the ADA, or like somebody would under the Fair Housing Act for housing. So it's got to be a disability or several conditions that affect his or her ability to access education or make academic progress. And that includes things like extracurricular activities. So there's really go back, please. There's two different laws that come into play when we're talking about accommodations for students, and that is IDEA and then the ADA. So we have IEPs, those of you who work with in pediatrics, I'm sure you've heard these words before, individual education plans. And for those, there's actually a list of 13 disability categories that are specifically defined in the law, and you have to meet one of those in order to be able to get the accommodation. The 504 plan is much more broad. It's more like what we were talking about under the Fair Housing Act and the ADA, where you have to have an impairment that limits one or more life activities. And the accommodations under 504 plans try to work to limit the playing field. So it doesn't change the curriculum the student receives, but it helps provide them that extra little thing that they need so that they can do the same stuff. So when we're talking about students, is the next slide where I want to go, Sam? Sorry. Yeah, so for example, we have student athletes who might need extra access to rest or extra access to water breaks when practicing or playing their sports. Same thing with children at recess. Maybe they need access to more shade because of a health condition that they have. So those types of accommodations, just like we were talking about with the ADA and the Fair Housing Act, the parents would submit a letter to the school, and then the school would do an investigation to find out whether or not the student meets the 504 plan or the IEP, depending on what their conditions are and what accommodations they need. Next slide. That's back to you, Sam.
All right, so benefits for the healthcare provider. So the major benefit would be you'd be helping your patients. Another good benefit is that there's no liability for a provider to provide a letter of support for their patient when they are making one of these type of requests. And your only thing you have to do is just provide the letter and that's it. You do not have to be a part of the follow through of it. You could just tell them, reach out to your local legal aid if they're denied, if the employer or housing provider or workplace denies the accommodation, and provide a list possibly of legal aids in their area. And we do have a list of the legal aids throughout the state of Florida that if you're looking for a legal partner for an MLP, you can always feel free to contact them, or possibly Christina knows them personally and she can do a soft introduction between the two of you to kind of explore the possibility of creating a medical legal partnership. But the templates are designed for providers with or without MLPs to use. So it's definitely not a requirement to have a legal partner, but it is always in your benefit too, because a lot of different things come up with someone due to the social determinants of health that we always find another issue that we can help them with. But this is always a good start in advocating for your patients. All right. I don't have access to the chat, so I don't see if there are any questions.
I haven't seen anything in the chat.
Okay.
May I ask a question?
Go for it.
Thank you. Thank you for the presentation. I can see how that's really important work and documentation that could be used. So as a immigrant and a student that works in clinics where we see immigrants, do the provisions covered by these letters apply to undocumented patients?
Yes.
Yes. Yep,
Yes. Everybody is covered and protected by the ADA and the Fair Housing Act, and also the school
Awesome.
laws that
Thank
apply to this education. Yep. Now, that doesn't mean that they're not going to have more problems, right? So this is why we encourage you guys to work with a local legal aid, because it's housing that I'm really referring to. If a landlord knows that the folks are undocumented, I mean, they retaliate in all sorts of different ways I've seen happen, and that happens whether they're documented or not. But even more so for those who are undocumented, right? Because they're more fearful of having to go to court and those types of things. So especially in those instances, I would encourage working with a local legal aid to make sure that there aren't going to be those kind of repercussions for folks. And also you might find that there's immigration help that's available to them in terms of like trying to obtain status.
Sounds good. Thank you.
You're welcome.
All right,
We have other questions?
This is Melissa. I just wanted to get more clarity because it sounds like with housing that, as you mentioned, for the disability qualification, they're a little more lenient in terms of like asthma would qualify. But I'm wondering for students in particular, just an average student who is at football practice and overexposed to heat, if they don't have like an IED or a pre-existing disability, do you think this process wouldn't work for them, or how exclusive is that requirement for the disability or the IEP?
So I think that when we're talking about students who don't have an underlying health condition, that then we're talking about all students, right? We're talking more about the full population of students. And in the Florida heat in the middle of summer, when football practice happens with full gear on, which weighs like another 20 pounds or so and is super hot, they probably should be doing twice as many water breaks and shade breaks for all teams throughout the state, you know? I don't think that these letters are going to get special treatment for one student. I think that if you had a situation where you had students who were practicing and they weren't getting the breaks that they need to perform in general, that's something that would more need to be taken up as a whole, as a collective amongst, I would say, team parents, and then to the school really, or to the school board, to kind of try to change the rules around those types of things. Under the two laws that we talked about, IDEA, and then with the IEP plan, or the 504 plans rather, those are specific for students who have health conditions. So, and that can be shade, that can be water, that can be a student who needs to go to the clinic because they need to use their inhaler throughout the day, right? That is an accommodation in and of itself.
Okay.
So if I could just add to that, so this is Fred here. So I think we all know that in Florida, we are the proverbial canary in the coal mine, and we are on the front lines of climate change wreaking havoc on our low-income communities and impacting their health. So I do think, just for those clinicians on the call, we've probably already seen patients coming into our clinic who they don't necessarily have to have a chronic condition. Like, they can be a 15-year-old kid who actually felt really lightheaded when he was out there running cross country and just like has trouble keeping up with his peers. And you can actually document that in your record about dehydration, risks for dehydration, those kinds of things. And I actually think you could easily make a case, if you are a good clinician tracking a patient longitudinally, about how you do need to make that reasonable accommodation for your child, in this case, who may have some adverse effects of exercising in the Miami sun. So I don't think you need to, for example, classify them as having, moderate persistent asthma. If you know the child over the course of years and you've known that they've had 2 syncopal episodes, or they've had pre-syncopal episodes, and they've had an ER visit for having passed out or something like that, I think that all helps you build the case for you to be able to then make that request for reasonable accommodation. That, once again, the takeaway for me when I was learning from the MLPs is that these patients of ours do not need to meet the Social Security definition for disability. They just need to have been negatively impacted in a tangible way that you can medically document. I think that then allows us to write these letters. And ideally, if you're a pediatrician or family physician who cares for a number of children who go to the same school, and you're seeing this becoming more of a systemic issue, that might then behoove you to reach out to the PTA or collaborate with parents to maybe reach out to the school directly to see if more of a systematic approach can be approached.
Thank you. That's helpful, Dr. Anderson.
And I agree with Dr. Anderson. If you take nothing else out of this conversation, take away that the definition of disability is not Social Security's definition. Like if that's the only point that you learn from us today, that will do your patients a ton of good. Because that seems to be when we talk to folks who aren't as familiar with the MLP involvement and how they as clinicians can help us on the legal side with things, the fear tends to be like, well, I'm not the person who should be making a determination as to disability, or I don't think this person's disabled, but they don't know the definition of Social Security or the ADA or whatever law it is that we're working under. So it's really that nexus between a health condition and then the accommodation that is the focus of these letters.
Good feedback. Samantha, do you want to show us the templates?
Yes, are you able to see them on my screen?
Yes.
Oh. Right, so I'll actually go to the first template. So this is our reasonable accommodation in housing, the request to terminate a lease. As I stated, these are the 4 different sections that we have to this one template. So the first page is going to be the most important to the healthcare provider, because it's going to definitely inform you that what the definition of disability is under the Fair Housing Act, because we're not using Social Security's definition, how it's more lenient in that way. As long as you kind of draw the nexus between the health condition that the person has and the request for the accommodation that they're seeking, that is sufficient enough. All right. And I can provide these 4 templates to Melissa, and she can share it with the rest of your network. So you can, review them, provide feedback. If you have any questions on one of the templates, you can reach out to Christina or I. Our contact information will be included. Or if you would possibly have another type of situation that you see often in your practice and you have a question about, you can feel free to reach out to us too about that. And then the second section is the information for the patients. And this is much longer because it does have a lot of information that they would need, even more information than they probably need, because we don't want to overwhelm them with information, but it definitely explains the Fair Housing Act. And not all housing is going to be covered under the Fair Housing Act, but most of it is. So it's likely that the patients that you have, whatever housing they have, is going to be covered. If for some reason they're denied, gets denied for whatever reason, because landlords just typically deny, then an attorney can get involved in that situation and determine, is this the correct law that we should be using for the accommodation, or should we rely on another part of the Florida statute that can possibly help your situation? All right, and then this kind of explains, this state you're disabled, why your accommodation is necessary, and then the nexus, which is going to be provided mainly by the support letter from the provider, and terminating the lease just to help you to promote you living in your property and you're able to enjoy it and use it. Another thing that this is really important for this section of the template, it does let the patient know that the purpose of this letter is just strictly to terminate the lease, and that's it. You're just requesting, I want to terminate my lease. This does not mean that you're going to take other legal recourse against your landlord, like stop paying the rent and remain there. This is strictly to see if your landlord's going to accept or deny your request, and that's it. So if they have another goal in mind, then a reasonable accommodation might not be the best route for them to go, but it definitely is a good option for patients to take. Right, and
so I have a quick clarifying question. I think you just answered it, but so then a reasonable accommodation request is strictly to terminate a lease. It's not to repair whatever problem there is. Is that correct? It's not asking it to make better. It's just asking to leave.
The request that you're making is going to be specific to the action that you'd like to see happen. So if your reasonable accommodation is to terminate the lease, then that's what it's going to be for, and that's it. It would be a second type of request if you're requesting to do a repair of the property. That's something different. So you want to be as specific as you can with the accommodation that you're seeking.
So can I also just speak to that? So great question, Melissa. So there's a whole slew of reasonable accommodations that can be made to landlords. What we were focusing with these letter templates is how we can envision these letter templates with a climate lens to help mitigate our climate vulnerable patients. But for example, just last month, I had a patient who has very advanced osteoarthritis of her knees. She struggles to get up to her second floor apartment. So I wrote a reasonable accommodation request to ask her landlord to see if she could be switched to a first floor apartment. That has nothing to do with climate as far as I'm aware, but so I just wanted to point out that reasonable accommodations can really take all sorts of different forms so that we're allowing that patient to not be limited by whatever physical impairments being exacerbated by that condition. So here we were just looking at, once again, two climate sensitive perspectives, that somebody's living in a housing condition that's frankly no longer suitable for human habitation, maybe because of mold, because of horrible pest infestation that's been exacerbated by climate change, that we want to be able to allow them to terminate that lease without being penalized, etc. And then the second one is if they're living in that place without their ceiling fan working for the last year, they really should be able to make a request to have that fixed. So I know this is a complex topic, but does that make sense, Melissa, or answer your question?
Yeah, that really does make sense. Thank you. Yeah, that clarifies it. Thank you.
And Melissa, another clarifying point, everybody, disabled or not, has the right to have their housing habitable when you're renting. So if you started renting a place and then the toilet stopped working, right? Like anybody, whether you had the disability or health condition or not, would be able, there's other template letters that you would do to request the landlord to make a repair. And to Fred's point, the accommodations can be, there's a variety of things, but we focus on two kinds of accommodations: terminating the rent or the lease, and then replacing or repairing the cooling agent. Other things besides moving down to your first floor apartment, if you have problems using the stairs, things like removing carpet from an apartment when you have asthma. Asthma comes up a lot in these examples. But I've had that case before where I had a child, a little tiny baby, was having all sorts of respiratory problems. They kind of narrowed it down to, let's move out. The doctor did kind of narrowed it down to the carpet's probably a problem, and then used a different template to request the accommodation of having that carpet removed so that the family could remain in that unit. So again, all different kinds of accommodations that can be done. The employment and the education letters are a little more broad in the way that we've written them, to where the accommodations are, there's more types of accommodations can be written into those letters versus just terminating your lease, just fixing the cooling agent. So
good example. Thank you. Thank you for that.
You're welcome.
Yeah, and I will pull up an employment one.
So you see there in the middle of the employment one, those bullet points, the idea that this would be in your electronic health records. So places where we have like, this would be, the bullet points would be a drop-down menu in your EHR. So the different things that would be, or the different accommodations that would, or different health impacts. And then the second down there at the bottom are different types of accommodations that can be made in work. And some of these are climate related and some of them aren't necessarily. And that's because we wanted to try to keep it a little bit broader to be used by you all in more than one scenario. And also because we're sharing these with our network of MLPs throughout Florida. And so we were trying to make it so that you could see the breadth of how these can be used.
Interesting.
So we have like exposure to toxins or hazards, modified duty, accommodation for time off for medical appointments or adjustments in schedule, right? A place to store medication if necessary. And then things like we've been talking about, water, shade for folks who work outside. And then the student one is very similar. Sam, if you want to scroll down. And the letter that's coming from the patient and the letter that's coming from the clinician in these templates are almost identical. And the reason that we have it that way is because under some laws, it's the person who needs the accommodation is required to make the request, but having that extra backup, something signed by the physician, helps them with evidence to prove that they need that. So it kind of, by having the doctor's signature, it kind of helps for evidence and gives extra support. And you know, sometimes, like I say all the time as a lawyer, sometimes just having my letterhead there and Esquire at the end of my name gets things done. So same thing with you guys, having that MD at the end of your name or ARNP or whatever helps give that extra boost to the patient. I saw a question pop up about whether these can be used in Florida or if they need to be used or if they can be used in other states. So the Americans with the ADA, I'm trying to think, all 4 of the templates that we did here are under federal statute. So we have the Fair Housing Act, which is federal. We have the ADA, which is federal, and then also the 2 education laws are both federal laws. So they should be able to be used in other states. You have to make sure, double check with that is why partnering with a legal aid is always great. You want to double check to see if there's any additional protections that your state offers. For example, in fair housing, Samantha mentioned a list of protected classes, and we've been only talking about disability here, but in terms of protected classes under the Fair Housing Act, there's 5 or 6, but some states and counties have expanded that to include things like gender identity and sexual orientation, which here in Orlando, that is true, but in neighboring cities and counties, not true. So there might be additional protections for you where you're at that you would only really be able to figure out, I guess, working with a local legal aid or attorney in general. Sam is showing the education template. And so you see that there's kind of a checkbox for selecting the major life activities that would be impacted if these accommodations aren't provided. And they really are the full breadth of things that we do on an everyday basis, and then include things also like learning and concentrating for students. And then there's a list there of some potential accommodations that can be provided. And some of those are climate-based and some of them not necessarily, because like I said before, we were trying to show you how these can be used in other ways as well. Do we have any other questions?
I have another comment. This is Fred again. So we recognize that these 4 letter templates are just the beginning, that we actually would love to hear from the FCCA clinicians who are seeing the climate impacts on their patients to let us know if there are additional letters that they think may be of use to them to help advocate for their patients. Just like brainstorming, we know that certain municipalities like Jacksonville passed an ordinance mandating that screens be available, actually intact and maintained in rental housing. That's not the case throughout this state of Florida. But I would imagine you could maybe make a reasonable accommodation case. I guess it's a question to Samantha Cools and Christina. If you had a patient who maybe a child who was being bitten up by mosquitoes all the time and had a bad dermatitis as a consequence, and they were living in substandard housing with the screens totally under repair, you could probably make a case, couldn't you, for a reasonable accommodation for a medical condition that you're treating them. Yeah, so I think there's.
I'd have no problem making that argument to a landlord.
I don't think I would have any argument on that either. So the problem is that in Jacksonville, you probably could literally cite the city or the county code that the law, the landlord is violating by not following it. But here you're kind of making the connection to the fair housing law. But I would love to hear from FCCA clinicians if there are other impacts that they're seeing that they could envision perhaps a legal advocacy point of view so that we can try to make a difference for our vulnerable patients.
And that's a great point, Dr. Anderson, that law was changed because of the work done by the Medical Legal Partnership up in Jacksonville. Out of Jacksonville Area Legal Aid, they partner with Wilson Children's Hospital and a couple of clinics out there as well. And it was during the Zika outbreak that they noticed, because Jacksonville is such an old city, a lot of the older housing rental units don't have central air. So folks leave their doors and windows open. And then that's how this came around, was because of Zika, and that they were able to do some legislative advocacy at the county level and have that ordinance passed. So that's another great way of how medical legal partnerships work, but with the partnership between the healthcare providers noticing this issue and then using the legal team to help them make an impact, not just for one patient, but for all the patients that they see.
And then I see the question here from Dr. Mitchell, who's with our parent organization, the Medical Society Consortium on Climate and Health. Asking if we can share this webinar and templates on the national website. I am planning to share them on our state website, and I'm open to that as long as our presenters are okay with that as well. So I think that's a great idea to share these wonderful templates that you guys work so hard on.
I think that would be fine.
We would be, I can at least speak for myself, I would certainly be delighted, and if they would like us to present, I guess, some of these ideas. We do work with some of our national MLP advocates, so I think they were also looking at some potential for sharing some of these best practices across state lines. So I think we would be eager to share these, and frankly, I would love to know if other states are doing similar things that we could learn from them as well. When we asked, we didn't hear about that per se. But we know a lot of states like New York and California have far more progressive legislation that they can actually, insist on air conditioning and so forth for some of the rental units that we don't have in the state of Florida. I also think that we have some future work to do. So I think that one of the things that we could do is that we could aim to translate some of these into patient Creole and Spanish, at least for the patient educational slides, the pages. So. But we wanted to wait till we got some clinician feedback on these letter templates and the patient educational before we sought to move to translate them. So I thought we hope this is just an ongoing dialogue as we continue to try to expand upon the toolkit that physicians can use to advocate for their patients.
Yeah, and I see a good comment here from Miranda that it's important to emphasize that the letters are not a liability. I think that's a really important point, that you're just empowering and helping to protect and advocate to improve the outcomes for your patients. So I think that's an important point. We're coming up on the hour, and I'm just so grateful to all of you for this collaborative effort. I'm just so impressed with how well it's come together and the different folks who have contributed to it. And thank you so much to all of you. I think that there's a real opportunity for these letters to be used to help patients. And in particular, the thing that stuck out to me was just rodents and roaches, and my understanding is that that can contribute and make asthma worse and allergies worse. And so I'm really intrigued by that concept behind the link between the environment, the climate, moisture conditions, and rodents and pests and how that affects our health. I anticipate that it's possible that when some of our clinicians are working or seeing those patients that live in that substandard housing, that's something they see. So I'll be interested to see if there are clinicians who are able to use those letters for that point. Does anyone else have any other questions or thoughts or comments? I'm trying to chat some links in here, but they're not going through. So what I'll do is after this call, oh, I see. There's a school environmental health coalition that is advocating for similar letters from clinicians. Well, good. I think I'm just thrilled. Dr. Anderson, I was so excited when you presented this idea, and I'll admit that I didn't know what it was. So when you first brought it up, it seems like it's probably been a year. And just to see how far it's come and all the hard work that Samantha and Miranda and all of you, Christina, have put into this. And also thank you to our clinicians and our steering committee who have helped to edit and give feedback on the letters. I think you're right, Dr. Anderson, that there's more that we can do with these. And I'm also excited too about the relationship between this initial advocacy and ultimately legislation. And in particular, I know that we want to be engaged in legislation for outdoor workers' rights and access to rest and shade and breaks. And so that's another area of work that we intend to do more of. And actually, that's going to be something that we talk about at our symposium in January. So, all right, well, I'm going to go ahead and close out the call unless anyone else has any other comments. I want to thank all of our presenters for your work and your time. And I'm hoping that folks will be using these letters. What I'll do is everybody who's registered for this webinar, I will share a link to the recording after we've posted it. And I will make sure to share a final copy of the PDFs of the letters. Is there any other requests or any other questions from anyone? No? Okay. Well, happy 2020 and holidays. Happy end of 2020, I'll say. It's close, guys. We're almost there. So I hope you all have a good evening, and I'm really grateful to all of you for your time. I know it's been a really hectic year, and I know you're all busy, so your time means a lot. And thank you so much for spending it with us at Florida Clinicians for Climate Action. And thank you to our presenters for your ideas, your thoughts, and your hard work and giving these tools to our clinicians. So thank you, everyone. Have a wonderful evening. Bye-bye. Good evening.